Welcome back to our channel Health Tips 23, where health is always our focus. Today we want to look at disorders in pregnancy that requires immediate attention. In previous videos we had looked at some minor disorders in pregnancies, but today we want to look at the disorders in pregnancy that requires immediate attention. Most minor disorders can escalate into more serious complications of pregnancy. It is important to seek advice if at any time the pregnant mother feels unwell or the signs exceed what they had been led to expect. So we look at some of the cases that if a pregnant mother sees these signs, then she's going to rush to the hospital. Vaginal bleeding, maternal anxiety for whatever reason that causes her to be anxious, decrease in fetal movement. And when we say fetal movement, your baby usually move 10 times through the day, and you notice the baby only move one time or two times, then that's something that causes a concern, because of course the baby we cannot just we can see the mother as we looking at her, we can see, but we cannot look at her and see the baby. So we just have to use the little signs and those are some of the things that we want to use to know whether if the baby is doing well inside or not. So if the fetal movement decreases, then of course nothing to watch, nothing to seek immediate attention. Frontal or recurring headaches. Say the mom's having headaches, say over the frontal region, the forehead, or headache that was there and then it comes back now. So sudden headache sometimes. Yeah, and of course this headache can be anywhere. Sometimes you feel it at the back, the neck, and things like those, because these are signs of high blood pressure. And of course that's not a joke, and there's nothing to watch about high blood pressure. Alright, you have sudden swelling where you might have the fingers become swollen, the face becomes swollen, sometimes the abdomen is swollen despite the mother is pregnant. The abdomen can be swollen. How she knows if you should put your feet, even if for instance you're wearing a pants or a skirt or something like that, or even yes, something like that, then the button, then you might see the pitting where you can see where the button presses on it. It leaves the pit there. So with that now you know that yes, it's swelling. The feet as well. It can be anywhere in the body that the swelling is. So with that, it's not something that you are to watch. Rupture of membranes. And with the rupture of membrane, that means the water broke. Right. So this is something that you can't miss, because for say a person who's their first pregnancy, you can't miss it, because once you will just see a sudden gush of water just coming down in the underwear or something like that. Sometimes you can be in the shower, or you might be bending down to do something, and you just feel a sudden gush of water come down. Then that is a membrane that is ruptured, right? premature onset of contraction. And the contraction that mean and so you start feeling pain in the tummy. You start having pain in it where and you notice contraction that mean it goes on and half. And so with that now say it could be that you're going into premature labor. So say you cannot watch that because unless it is a term baby, you don't want the baby to deliver before because chance of survival can be very slim. So you want to make sure that you go to the hospital. And I mean, seeing these signs and going to a private doctor, sometimes I would prefer to advise you to go to the hospital where anything you can be admitted just to shorten the journey because sometimes you go to the private doctor, and when you go to the doctor is going to give you a referral and send you off to the hospital if you want, if an admission is needed. So it best you just do it quick, and just do that instead of having to move two times, you move just one. All right, so that is it in a nutshell. And until thank you for listening. Thank you for watching my videos, and please like, subscribe, and share. Tell a friend to tell a friend to subscribe to this channel. Thank you. Until bye.